Hello and welcome to this week's edition of the Get Healthy Talladega County Show. I'm Lori Corley and we're pleased to have you with us today. We have a great show coming up, a very timely show. We're going to be talking about Medicaid and fully funding Medicaid. Our network is very interested in promoting health and wellness throughout Talladega County, and one of the best ways to do that is to make sure that our children and older adults have the insurance that they need to take care of themselves. So we have with us today a great guest. Our CEO from Coosa Valley Medical Center is with us. He is also the chairman of the board of the Alabama Hospital Association. As well, my co-host today will be Margaret Morton, who is the executive director of Safe Family Services. We'll be right back with you in a few minutes to talk about this very timely issue. Come right back.
Beating the train? It's a deadly game.
Come on, dude. You can beat it.
Always stop at crossings. Never drive around gates or flashing lights.
What's the matter, you chicken?
It's not only illegal, it'll get you killed.
Buck, buck, buck.
Remember, the train always wins. So let it. Drive safe, Alabama. A message from your Alabama Department of Transportation.
Are you looking for a great deal on a new Toyota? At Toyota of Sylacauga, today is your day. Our record-breaking sales last year proves why hundreds of people are choosing Toyota of Sylacauga. We provide transparent pricing, great service, and a no-pressure buying experience. Right now, all new 2016 RAV4s, Corollas, and Camrys have big discounts, plus 0% financing available.
Check us out online 24/7 at toyotaofsylacauga.com. Get ready to smile.
Camping World would like to introduce you to a whole new world. Say hello to a fresh day. Step out to adventure. Explore and discover an amazing world. Be in arm's reach of wonderful. Camping World, the #1 RV and camping expert, wants you to say hello to a whole new world.
Say hello to great deals during the RV sales event. Visit your local Camping World today.
The gift you've been looking for is waiting at Carden's Gift Cottage on West Fort Williams. Our friendly staff will show you cool raincoats and all kinds of carry bags, neat signs and heavenly scents, colorful lamps and fun beds for the kids, custom car tags and monograms and just about everything. Plus, new items show up all the time. We'll even wrap it for you too. Heck, we'll even rent you a U-Haul trailer or truck to get it all home. All this, and we make keys too at Carden's in Sylacauga.
Thank you for coming back and joining us today. I'm Lori Corley, and today co-hosting with me is Margaret Morton, the Executive Director of Safe Family Services here in Sylacauga. And Margaret's involved in a lot of different statewide coalitions that really promote the work of Get Healthy Talladega County, but also children's health and wellness across the state through the Alabama Network of Family Resource Centers, and also Voices for Alabama's Children, along with a number of different children's children's advocacy organizations, as well as working with East Alabama Regional Planning and Development and Senior Services. So there are just a lot of things that you're really involved in. And also Glenn Sisk is with us today from Coosa Valley Medical Center, the CEO there, and also the chairman of the Alabama Hospital Association. So thank you, Glenn, for being here today. And Margaret is going to lead our discussion about all the different things that Coosa Valley is doing in our community and all your new awards. And so we're going to take a good amount of time to talk about that, and then we'll move into our discussion about Medicaid.
Sure, and thank you so much, Lori, and I want to say a special thank you on behalf of the Get Healthy Talladega County Network and Glenn and myself and others of our primary partners who you still will remain being one of those. A big thanks to you for all the hard work you've done to bring us to this point in Talladega County and in the region. And as you move forward in your career and you move over to East Alabama Regional Planning and Development Commission, thank you so much for your service with us. And we don't mind so much letting you go, knowing you'll still be a part of the family. So,
well, thank you so much. It has been my great honor and privilege to work with you all, but to also get to know you very personally and call you my friends. Thank you.
Today, having Mr. Sisk here with us is a special honor because Coosa Valley Medical Center and Glenn Sisk have taken such a tremendous leadership role, not only in our network but across this state. And so we are so proud of the quality of healthcare resources and services that we have in this community, and it's largely because of your leadership and that of your leadership team. So most recently, Coosa Valley has, well, I'd say over the last 3 or 4 years, Coosa Valley continues to be recognized at the national and state level. And we are, and we say we because we feel as though we are very much a part of that. We in our community and in our service area have one of the top 10 hospitals in the state. If you're sick, that's where you want to be, and aren't we lucky here in Talladega County and Shelby County and Coosa and Clay County and across this region that we have you all in our community as one of, I think, our largest employers.
Yes.
So with that said, Glenn, could you sort of give us play-by-play of where Coosa Valley has been and where we are now?
Sure. Well, thanks again for the opportunity to be here, and I'd be remiss if I too didn't echo Margaret's thoughts. Lori, congratulations on your work. Best to you as you head just a little further east, and the work that you guys have done to bring the community together, education leadership, healthcare providers, and the benefits that so often don't get recognized in the community based on the work that you all have done at SAFE and through the grant. So congratulations for your work. I was just going to let you continue to talk about Coosa Valley Medical Center. You were doing a fantastic job. As you mentioned, Margaret, we were very pleased to be recognized as one of the top 10 hospitals in the state. Frankly, what made that so special was we didn't have to apply. We actually didn't know that was underway. It came as a surprise in one way. We didn't know it was coming, but recognition of the great work that our team does every day at CVMC at the bedside, meeting people at their point of need. Obviously, that was driven by a number of factors, not the least of which is clinical quality. And I think it's important to note today that healthcare consumerism has changed. The ability for people to know and understand their healthcare provider has improved dramatically. And frankly, I think we would all agree that that should be the case. You shouldn't come to a hospital, you shouldn't come to a doctor's office today, and while you might not understand everything that's occurring, you should have the ability to transparently learn and understand the care that's being delivered. So we've had to change. We've had to adapt over the last decade or so, recognizing that healthcare consumers are much more educated in their care today. So that was a recognition of the great clinical care our team provides, as well as the experience people have on an interpersonal level. So we're very proud of that work. Another thing that we've celebrated is the Beacon Award for Excellence. That's care that's been delivered in our intensive care unit for the last 3 years. When we won that award 3 years ago, we were one of 3 hospitals in the state of Alabama to be recognized, along with East Alabama Medical Center and Opelika and Children's Hospital of Alabama. So we were very proud that CVMC was in the company of those 2 fine organizations. Our emergency department has done a lot of work in the area of stroke care over the last few years. And for the last few years, we've been recognized both for the Silver Stroke Award for Excellence and now, most recently, the Gold Award of Excellence. That's very, very important, that if people are having stroke symptoms, that they move quickly, that our team reacts within the first 30 minutes or so of those symptoms to ensure that there's no prolonged issues down the road. And then finally, the last thing that I would mention is the Joint Commission, which is the accrediting body for hospitals throughout the country. Since 2012 has recognized CVMC as a top performer each year, which generally means in the top 5% or so of hospitals in the country for the clinical care that's delivered in our each respective organization. So a great credit to our physicians, our nurses, our therapists, technicians, people at the bedside every day meeting people at their point of need.
Exactly, and I know from personal experience with friends and family, the value of having a real hometown connection with our medical community gives you such confidence, but also the quality of care I think is cannot be met anywhere else. It's just been amazing to see that happen. I'm born and bred here in Sylacauga, and actually was came into this world at then Sylacauga Hospital, and wow, has that facility alone expanded and grown. And one of the things we were talking about earlier was the other services that Coosa Valley provides to the community, and being complimented on the Hickory Street Cafe. It's interesting to me because when people come into our community and we bring people in and they want to hear about Sylacauga, and one of the areas of interest happens to be the fact that, you mean the hospital is also a caterer? And what a fabulous job you all do with that. And of course, again, your team, your administrative team is superlative.
Well, they are. As Lori mentioned, I have the opportunity to work with the Alabama Hospital Association, have for a number of years, and that affords me the chance to see other hospitals throughout the state, meet and interact with hospital leadership teams. And I don't say this because I work with them every day and they're going to see your show and hear me say this, but it is a true privilege to work with the folks who are on that administrative team. And actually reaching further into the organization, the leadership team, the department directors who make things go every day. And we talk often about, we want you to feel like you own this part of the business, that you literally own individually this nursing unit, this imaging department, this rehab department. And that's the sort of embrace that we've seen from that leadership team. We're very, very fortunate and thankful for good people who make it happen every day.
And I think it's also exceptional in Alabama and in rural Alabama to have the quality of care that we are privileged to have here in our community through Coosa Valley Medical Center and with citizens as well. But there are challenges, I know, that come with assuring that that level of quality exists, and the fact that our economy depends on it. Our economy depends on you being successful at Coosa Valley Medical Center. Could you sort of touch on how that all integrates in case there are people that don't make that connection?
Sure. Well, I think you're exactly right, Margaret. Today we are the largest employer in the city of Sylacauga. We have about 640 team members who call it their work home every day or every week. That obviously stimulates the economy in ways that you might not routinely understand. Our annual payroll is about $26 million. So you think about the opportunity not only for payroll taxes to be put back into the economy, but those paychecks that allow people to go shop at local establishments here in Sylacauga obviously makes a huge difference. Now, I will tell you this, you're exactly right. Hospitals today are struggling. The financial challenges that we face every day at Coosa Valley sometimes feel like the mountain's pretty tall. And we work very hard to manage our expenses. As a matter of fact, I would tell you, as we compare ourselves to other hospitals in the state, other hospitals especially in the country, you'll find us among the lowest cost providers, not only in Alabama but across the country. We measure how much does it cost to provide labor to the organization. For us, it's about 42 or 43% of our gross revenue. That's the lowest you'll find in the country for either nonprofit or for-profit providers. So we manage very, very effectively, but we have a reimbursement problem in our state. Medicare, Medicaid, among the lowest reimbursement rates anywhere in the country, right here in Talladega County. And really, it's very, very unfortunate. And again, I appreciate the opportunity that you ladies have afforded us to talk about those challenges and hopefully find some solutions in the future.
Exactly, exactly.
Well, we're going to come right back. We're going to take a quick break and come back and talk more about those challenges that are coming up and what we are facing here in Talladega County. So we'll be right back. Please join us.
The greatest threat to law enforcement isn't criminals, it's drivers. Roadside crashes are the #1 cause of death for police and state troopers. And not just them. Tow truck drivers, maintenance workers, risking their lives every day. Alabama's Move Over law requires you to safely move over when you see flashing lights on the roadside. And if you can't move over, slow down. Drive safe, Alabama. A message from your Alabama Department of Transportation.
Are you looking for a great deal on a new Toyota? At Toyota of Sylacauga, today is your day. Our record-breaking sales last year proves why hundreds of people are choosing Toyota of Sylacauga. We provide transparent pricing, great service, and a no-pressure buying experience. Right now, all new 2016 RAV4s, Corollas, and Camrys have big discounts, plus 0% financing available.
Check us out online 24/7 at ToyotaofSylacauga.com. Get ready to smile.
Camping World, the #1 RV and camping expert, would like to introduce you to a whole new world. Say hello to new thrills. Get to know your crew. Moments become great memories. Take a new look. Enjoy freedom. Discover amazing. Say hello to a whole new world. Visit campingworld.com.
The gift you've been looking for is waiting at Carden's Gift Cottage on West Fort Williams. Our friendly staff will show you cool raincoats and all kinds of carry bags, neat signs and heavenly scents, colorful lamps and fun beds for the kids, custom car tags and monograms and just about everything. Plus, new items show up all the time. We'll even wrap it for you, too. Heck, we'll even rent you a U-Haul trailer or truck to get it all home. All this, and we make keys, too, at Carden's in Sylacauga.
Welcome back to the Get Healthy Talladega County Show. I'm Lori Corley, and today here I have with me Margaret Morton, the Executive Director of Safe Family Services, and Glenn Sisk, who is the CEO of Coosa Valley Medical Center and also the chairman of the Alabama Hospital Association. So now we're going to move into more of a discussion about reimbursement and the challenges that you face, Mr. Sisk, in the hospital with those funding cuts if they happen, and how that all plays into our entire economy in Talladega County. And Margaret has a quote, I think, from you recently on a post on AL.com.
Yes, I went to AL.com last week, and on April 6th, actually, Mr. Sisk was an op-ed guest. And when I saw his picture and his and the byline, I immediately was fascinated by knowing that Glenn has been very involved with this whole issue related to Medicaid. We've worked together on some other initiatives trying to help people get access over the course of the last couple of years. And I want to quote you because I think this sort of leads the conversation, as you so aptly did in this op-ed piece, when you said, and I quote, "With one vote, legislators declared to the people of Alabama their willingness to risk crippling a strong health care system rather than doing what is necessary to adequately fund it." Medicaid.
Yes, extremely unfortunate, and I'll try to put that in context first, and then we'll talk about more specifics as we go. First of all, let me clarify this. Alabama hospitals are paid by Medicaid, but not a single penny of those payments come through the general fund in the state of Alabama. The way hospitals are paid is we have an assessment, a tax, if you will, on ourselves that we pay through a means called intergovernmental transfers. And this assessment then is used to maximize the federal match in this case at CMS in Baltimore, which is a 1 times 3 match. So we take the dollars that are generated from this assessment in Alabama, send them to the federal government at CMS, they match it times 3, and then those are the funds then that are used to reimburse Alabama hospitals for the work that's done. Now, that doesn't include physician payments, it doesn't include home care, all those sort of peripheral benefits, pharmacies, etc. But Alabama hospitals don't take a single penny from the Alabama General Fund. I think that's important for people to understand. So with this one vote that you just referenced, Margaret, what the Alabama legislature did was they said, in spite of the Medicaid commissioner, in spite of the governor saying we need $785 million to run Medicaid effectively at its current level, they voted and said we'll fund it at $700 million. So today we have an $85 million shortfall in the Medicaid program. We've been working now for about 4 years on a Medicaid transformation model, which is the regional care organizations. You're familiar with that. We're very fortunate that you have the opportunity to sit on a board associated with those RCOs, which is the acronym. We have a lot of acronyms in healthcare.
Yeah, we do.
And the RCOs are intended to really focus on getting care delivered in the right place, the right time, much like we have advocated with the Get Healthy Talladega County initiative. There are 5 regions in the state. Those 5 regions are then approved for certain providers. And in our case, we're in Region B. There are 2 provisionally approved regional care organizations, and they're scheduled to kick off on October 1, 2016. With the $700 million funding that the legislature approved, those RCOs go away. So Medicaid transformation, as has been anticipated now for the last 4 years, is not going to occur. That $85 million shortfall, that's number one. Number two, what the Medicaid commissioner has come out and said, benefits are going to go away dramatically. And many of those benefits matter, and of course, depending on who you are and where you are in your health life, some matter, some don't. For example, the commissioner has said we're going to take away orthotics, we're going to take away prosthetics, we're going to take vision care away for Medicaid recipients. But then it begins to get a little more significant. She has also said at this funding level, we can't have outpatient dialysis. If you're familiar with the urgency and the importance of having outpatient dialysis occur for those patients 3 or 4 days a week that are on that that program, that goes away. What happens to those Medicaid recipients? We don't do inpatient dialysis in Sylacauga, so those folks would be forced to travel, likely in this case, to Birmingham hospitals, and travel for many of the Medicaid recipients is a limiting factor.
Exactly.
One of the other challenges we faced in the state is a lot of primary care physicians have chosen not to take Medicaid in the state of Alabama. So access for recipients has been challenged. However, a few years back, a decision was made that with the Affordable Care Act and the opportunity the state had to change reimbursement for Medicaid for primary care physicians, instead of being paid a Medicaid rate, they would be paid at a Medicare rate. which was an incentive for many primary care physicians to begin taking Medicaid. The commissioner has said that bump goes away. She's also said that for those who provide care to Medicaid recipients, and in our community, if you look at the pediatric community, the majority of patients that are seen by pediatricians in Sylacauga, in Talladega, are Medicaid recipients. They're going to take a 22% reduction in their reimbursement. That's dramatic. There is an example in the state down in South Alabama where a pediatric group had announced that they were, as a matter of fact, they had been providing a satellite clinic. They were about to invest several $1 million in a new building. With this announcement, they've said no. So not only is it a public health issue in terms of access for Medicaid patients, but that's a great example of how the economic benefits that a vibrant healthcare system, and in this case with Medicaid, could add to a community's benefit, and now all of a sudden that goes away. So it's really very, very unfortunate, and frankly it's difficult for me and many others to understand how the legislature could make this decision understanding the consequences that are to follow, because they're very real.
They're very real, and I think the general public probably doesn't really understand who are Medicaid recipients. What does that look like? And when you mention children, those of us that are very involved in children's issues are very extremely concerned, because the majority of the Medicaid recipients, as you said, are children.
Right.
And these children will not have access to the kind of health care to keep them healthy, so that they won't be a burden on the system as they age.
Sure.
And it's just a spiral. It seems to me to be a catastrophic spiral downward for individuals, for the healthcare community, and for the community and state as a whole. So, Glenn, tell us what do Medicaid recipients look like?
It's a great question, Margaret, and really primarily on both ends of the spectrum. You pointed out the number of children in the state that are on Medicaid, and to bring that to life for you, about 67 or 68% of all the deliveries that we do in our women's and children's unit here at Coosa Valley are Medicaid recipients, Medicaid babies. You've seen examples in the state where hospitals have made a decision to get out of the business of delivering babies. I saw a statistic recently, I think about 15 years ago, there were some 56 hospitals in the state delivering babies. Today, some 27 or 8 of those have gone out of that piece of the business, which creates problems for moms and young children. So a lot of children on the Medicaid rolls, but if we fast forward through the cycles of life and we look at nursing homes in this state, it's not uncommon for a nursing home to have 90, 95, 98% of all of their residents on the Medicaid program. So all of a sudden you've got not only children who are being dramatically affected, but you've got nursing homes, residents, and families who are dramatically affected as well. And one thing I failed to mention just a moment ago, the commissioner is also evaluating the opportunity to really be forced to take away prescriptions for adult Medicaid recipients. Can you imagine the sort of catastrophic health events that will create, not to mention the impact on pharmacies? Obviously the big house pharmacies, the Walmarts, the CVS, the Rite Aids of the world, potentially can weather that storm just given their reach throughout the country. But you look at our local pharmacies, which are vitally important to our community, not only in creating jobs, but they do a fantastic job in providing prescription management direction for local residents. That would be a tremendous hit for them as well. So in many cases, Medicaid recipients are getting up, going to work every day. I think there's this common misconception that Medicaid recipients don't work.
Don't work.
Many of them do. Many of them go to work every day. We have a very unfortunate situation in the state with Medicaid. We have the most lean Medicaid program in the country with the most difficult qualification standards of any Medicaid program in the country. So it's not a rich program in terms of the benefit that it affords, and for a single adult, you earn less than $5,000. If you earn more than that, you can't qualify.
You can't qualify.
So it's a dilemma that's upon us, and unfortunately, if we don't find an answer, I fear we're going to have some catastrophic results.
You know, particularly when as you're talking about prescription medications, I know we have been a part of the Get Healthy Talladega County was a part of a study with UAB several years ago about this prescription medication management and polypharmacy senior adults who were either low medical literacy or low literacy in general. And the fact of the matter was, when they had access and when they had education, they didn't wind up in your corner of the world with some catastrophic medication event that resulted in hospitalization. And for a senior, that probably would mean ICU, a trip to ICU, and then the bills go higher and higher and higher. So if we don't get in on the front end, if we're not able to provide the necessities, and clearly those are necessities of life, just like food.
Sure.
And we know individuals, as we've said, who choose their medications versus eating. So it's a perfect storm that has brewed in our state. And I was at a meeting recently where even with Children's Hospital, for example, 63% of their population are their children and they're Medicaid.
Right.
Well, you take away those benefits and another system collapses. And but one of the things that was brought to the attention of the people in the meeting was that the Medicaid Commissioner and others have said, bring us the solutions. My understanding is, if I'm correct, that we have brought some solutions. The myth is, I think, that Medicaid needs fixing. How would you respond to that?
Well,
and you alluded to that earlier.
Right. Really, at their direction, the discussion around Medicaid expansion a number of years ago with the Affordable Care Act became a prominent discussion in Montgomery and throughout hospitals in this state. And the legislature and the governor at that time said, we're not going to expand Medicaid until we transform Medicaid. And that transformation model is the regional care organizations, the RCOs, which would be responsible for trying to lower the cost, lower the utilization of inpatient stays, which we support as healthcare providers. We think that if we can deliver care to Medicaid recipients on an outpatient basis, obviously the system is supported, the intended outcome clinically for that Medicaid recipient is usually better. But now all of a sudden, with the tease of expansion of Medicaid, which we know has not come, and the vote from 785 to 700 million means that the transformation in RCOs don't occur as scheduled. So obviously, the healthcare community is prepared. Work has been ongoing now for 4 years to bring these RCOs to life. We are not an owner of an RCO, but we fully prepare, as most hospitals throughout the state intend to be a provider, a contracted provider. And unfortunately, it doesn't seem that that's going to occur now.
And the waiver programs as well. That goes by the by.
And let's take a quick break and come back and talk about the waiver programs and also more about the RCOs. So join us back in just a couple of minutes.
Beating the train? It's a deadly game.
Come on, dude. You can beat it.
Always stop at crossings. Never drive around gates or flashing lights.
What's the matter, you chicken?
It's not only illegal, it'll get you killed.
Buck.
Remember, the train always wins, so let it. Drive safe, Alabama. A message from your Alabama Department of Transportation.
Are you looking for a great deal on a new Toyota? At Toyota of Sylacauga, today is your day. Our record-breaking sales last year proves why hundreds of people are choosing Toyota of Sylacauga. We provide transparent pricing, great service, and a no-pressure buying experience. Right now, all new 2016 RAV4s, Corollas, and Camrys have big discounts, plus 0% financing available.
Check us out online 24/7 at ToyotaofSylacauga.com. Get ready to smile.
Camping World would like to introduce you to a whole new world. Say hello to a fresh day. Step out to adventure. Explore and discover an amazing world. Be in arm's reach of wonderful. Camping World, the #1 RV and camping expert, wants you to say hello to a whole new world.
Say hello to great deals during the RV sales event. Visit your local Camping World today.
The gift you've been looking for is waiting at Carden's Gift Cottage on West Fort Williams. Our friendly staff will show you cool raincoats and all kinds of carry bags, neat signs and heavenly scents, colorful lamps and fun beds for the kids, custom car tags and monograms and just about everything. Plus, new items show up all the time. We'll even wrap it for you too. Heck, we'll even bring you a U-Haul trailer or truck to get it all home. All this, and we make keys too at Carden's in Sylacauga.
Welcome back to this great conversation we're having today with Margaret Morton and Mr. Glenn Sisk from Coosa Valley Medical Center, talking about healthcare in general in our community in Talladega County and also statewide Medicaid. So before we went to break, we were getting into a little bit of information about the Medicaid waiver programs and where we think that might go. If you could talk to us a little bit about that, Glenn.
Sure, Lori, be happy to do that. As a part of the Medicaid annual funding, the state of Alabama and the Medicaid department have been negotiating on a waiver program called the 1115 waiver. And the conditions of participation were recently approved. Everyone agreed, both in Montgomery and in Baltimore, that we were good to go. One of the key and really encouraging parts of that 1115 waiver program were transitional funds that were being given by CMS to the state of Alabama for Medicaid transformation, RCOs that we've talked about before. That number in the aggregate is about $138 million. So those transitional funds then became available to healthcare providers, programs like SAFE as well, to write letters of intent to say these are the things that we wish to accomplish. CVMC made a decision to request 4 very specific, 4 very real and needed support programs. Physician recruitment, as an example, an opportunity to really make a cardiology program locally more robust that we think would be very helpful. And then some requests for telemedicine that if someone shows up in our emergency department, for example, and we don't have a specialty represented, we could be in touch with a UAB, Grandview, for example, and have that specialist beamed in real time to evaluate care and determine what needs to happen. We really hope this works. Margaret, I think SAFE has made a request.
We
as
did
well.
on behalf of Get Healthy Talladega County, looking at the coordination of care through Get Healthy Talladega County. As you are very well aware, we have been able to fund 2 positions, one at Citizens and one at Coosa Valley as RN or social work case managers. That I think we're already seeing some pretty impressive positive outcomes for patients as a result of that. And so the concept is to grow that. If it works, let's do more of it. And particularly with the PEDS population and others that are underserved as well. So.
And Lori, unfortunately, we anticipate that if the budget is, as it stands today, has been approved, as your folks who watch your show probably know, the governor vetoed the legislature's move because the Republican majority. They then overrode the veto, so we are where we are today. if that budget stands, it's likely that the 1115 waiver goes away.
Yes.
Those transitional funds that would be so helpful, not only to communities such as Sylacauga, but tertiary medical centers in Huntsville, Mobile, Birmingham, those funds that would grow programs go away, and that's an unfortunate consequence.
And these are innovations that can be replicated.
Right.
We're building a foundation of reform. So when people operate under the myth that Medicaid needs to be fixed in Alabama, there's been a lot of work being done and has been accomplished. But we're at a crossroads right now.
Right.
And could you talk a little bit about, Glenn, if this does not happen, besides the crumbling of the system, what can be done now that could change that trajectory?
Well, I think there are some very real options out there that it would seem, based on everything we see, hear, anecdotally read through surveys, suggest that the state has a different appetite than we did perhaps a dozen years or so ago. And let me talk about a couple of those. One, today it's likely that nothing happens, nothing changes in the regular session of the legislature related to the general fund budget. So that begs the question then, do we have to face a scenario where special sessions are called, in this case by the governor, to bring the legislature back to discuss very specific needs? Last year, I think there were 2 special sessions, you may recall. And our position from the Hospital Association, from providers in the state, has been, legislature, hear us loud and clear. We're going to support you finding new sources of revenue. We don't know what those new sources of revenue are. We hear examples of things called the lottery. Now, whether or not you believe in a lottery, whether or not you've ever purchased a lottery ticket, I'd have to admit I bought a few when it reached about $1 billion. And I'd still come to your show if I'd won that, by the way. I'd still be here.
Thank you.
But a lottery is something that could certainly be beneficial in this state, not only potentially to support healthcare infrastructure, but education, which in many cases is challenged. Obviously, there's a lot of discussion around gaming, and we probably don't need to get into that too much because we don't want folks turning their TVs off whether they like it or don't like it. But really our position has been this: look, Alabama legislature, find new sources of revenue to support the $85 million gap. And whatever those sources of revenue look like, we're great with that.
Right, and I think there have been discussions regarding sort of that philosophy of robbing Peter to pay Paul, but we're all of our systems are stressed. And the idea that you would take from one for another is just not an option in this state. So it is incumbent upon our legislators and our people to come together to find these solutions and to be willing. And it may not be a perfect solution. Solutions rarely are perfect, but that we must, or we are going to have consequences that I don't think any of us want to face. And most people assume that it's just the Medicaid population that's going to suffer, but it's not, is it, Glenn?
It is not, and that's a fantastic point. That's a fantastic point. Medicaid recipients are not the only ones who suffer. We've talked about providers. It's not unreasonable to assume that physicians in this state who have a high percentage of Medicaid will leave this state as a result. What happens when someone doesn't have access to a primary care physician? Routinely, they utilize their emergency department as their primary care physician. High cost of care creates a backlog of patients that in many cases you have higher acuity patients that have to be treated right then and there, creates long wait times. So the system overall begins to be challenged. But not just hospitals, not just doctors. I've mentioned the pharmacies, I've mentioned durable medical equipment providers. Nursing homes are at great risk if these things continue. Home health care providers. So the system overall is certainly at risk, not just the Medicaid beneficiary.
And one of the points that was made, I was at a meeting last week about people like myself I have private insurance. My wait time in a physician's office, my travel time, because I may not be able to access health care like I can in Sylacauga, Alabama, where I can call, make an appointment, and see the physician by noon today if I'm sick. So it won't just be the providers or the Medicaid recipients, it's going to be me and you.
Correct.
And that people need to understand. It will affect them even if you are have your own private insurance. Right. It's going to have a catastrophic effect across the board. So there's a great need to find those solutions and to ignite sort of that firestorm, which you all have been doing through the Hospital Association and locally. And there are other groups that are working to make people aware, to educate people about what are we facing. And I want to talk in a minute about long term, if we don't find that solution, what could happen. But there are some opportunities to have your voice heard. There is a new social media campaign, and I want you to talk about some of the things you all are doing through the Hospital Association, called I'm Medicaid. And it is to educate people about, the general public, about what does Medicaid look like. You've described the Medicaid recipient beautifully. It's a child, it's a senior, it's a pregnant mom, it's a baby. But what do those faces look like, and what are those stories? I remember a very poignant story when you all helped to open the doors for people to see if they were eligible for the Affordable Care Act, and those individuals who we hear about the gap, and how many residents of Alabama are really in the gap who do not have access to health insurance, Medicaid or otherwise. But this was a story of a young woman who had worked in public health. And because of the economy, and when the economy went, what happens when the economy has stressors, then people lose their jobs, and she did. And she was working at a job at one of our local vendors, restaurants, and she didn't have access to insurance, and she had 3 children, and she sat at the table across the table from me one day, and she said, "This is what I'm teaching my children. My children are learning that as I come in every single day, I've got blisters on the bottom of my feet, and I'm working as hard as I can, but I can't go to the doctor." And she apologized actually for having had insurance before, because she said, "I never used it because I didn't want to stress the system." But it was such a sad story of a person who ultimately she was eligible for Medicaid. Will she be now? Will her children be? That's the question. So as hard as she was working to provide for her family,
right,
it wasn't happening.
Well, and unfortunately, we've not as a state taken advantage of Medicaid expansion. There are a lot of things about the Affordable Care Act that you'll hear people talk about that are problematic. Medicaid expansion has actually proven to be very, very successful around the country. Our governor and our legislature has said no. I think that's a travesty. Today, $3.8 million leaves Alabama to go support Medicaid expansion in other states. Now, let's do that.
Would you say that again?
Yes. Today.
Loudly.
Today, $3.8 million in taxes that are levied on people of this state are leaving Alabama and going to New York and Connecticut and other states to support Medicaid expansion. Those dollars were designated for the state of Alabama, and we've turned our back and walked away. The UAB study that was done on Medicaid expansion suggested that the state investment would be at or about $700 million over 10 years. But the return from the federal government was $11.2 billion. Now, those numbers are big and hard for us to understand, but think about that for a moment. If someone said, if you can give me $700 million, I'm going to write you a check for $11.2 billion, and the benefits that then provides to Medicaid recipients, to physicians, to pharmacists, to hospitals, is really, really proving to be very, very beneficial. And the thing that I'll point out is our Republican-led state has probably said no to Medicaid expansion because it was a Democratic initiative. Many states across the country now have said yes, led by Republican governors. and they're seeing real benefits in the state, not only from the healthcare infrastructure perspective, but also from a public health perspective.
Yeah. Exactly.
Well, we're going to take a quick break, and then we're going to come back, and I want us just to boil down 3 to 5 points that we want to make sure that everybody who's watching today knows, and how you can take action if you would like, or to learn more about Medicaid and our healthcare system as a whole. So come back.
The greatest threat to law enforcement isn't criminals, it's drivers. Roadside crashes are the #1 cause of death for police and state troopers. And not just them. Tow truck drivers, maintenance workers, risking their lives every day. Alabama's Move Over law requires you to safely move over when you see flashing lights on the roadside. And if you can't move over, slow down. Drive safe, Alabama. A message from your Alabama Department of Transportation.
Are you looking for a great deal on a new Toyota? At Toyota of Sylacauga, today is your day. Our record-breaking sales last year proves why hundreds of people are choosing Toyota of Sylacauga. We provide transparent pricing, great service, and a no-pressure buying experience. Right now, all new 2016 RAV4s, Corollas, and Camrys have big discounts, plus 0% financing available.
Check us out online 24/7 at ToyotaofSylacauga.com. Get ready to smile.
Camping World, the #1 RV and camping expert, would like to introduce you to a whole new world. Say hello to new thrills. Get to know your crew. Moments become great memories. Take a new look. Enjoy freedom. Discover amazing. Say hello to a whole new world. Visit campingworld.com.
The gift you've been looking for is waiting at Carden's Gift Cottage on West Fort Williams. Our friendly staff will show you cool raincoats and all kinds of carry bags, neat signs and heavenly scents, colorful lamps and fun beds for the kids, custom car tags and monograms and just about everything. Plus, new items show up all the time. We'll even wrap it for you too. Heck, we'll even rent you a U-Haul trailer or truck to get it all home. All this, and we make keys too at Carden's in Sylacauga.
And welcome back to the Get Healthy Talladega County Show. I'm Lori Corley. Thank you for joining us today. We have had an excellent and informative show today with Margaret Morton and Glenn Sisk from Coosa Valley Medical Center. And of course, we all know Margaret's from Safe Family Services Center. But we want to just give a few tidbits and 3 to 5 things that we want to make sure that people take away from the show today so that they can have their voices heard as well.
Yes. Well, I think first and foremost, this is not scare politics. This is reality, and this is reality for the state of Alabama, and this is reality for our communities. This is reality for people and reality in people's lives, and no one can speak more eloquently about that than Glenn Sisk, because he sees it every single day. Not just the bottom line on the ledger sheet, but the faces of the people that will suffer because of this.
Very well said, Margaret. I think one of the points that is important to consider is dependency on governmental payers in this state is significant. In our case, about 50% of everyone who walks through our doors are Medicare recipients, and about 25% of those who walk through our door are Medicaid recipients, though they take up about 32% of our overall utilization. So when those programs begin to crumble and go away, all of a sudden that infrastructure is challenged. And I think, to your point, this perception that hospitals and healthcare and medicine is big dollar business. It's expensive business, but there are no margins. In the state of Alabama today, hospitals, 78% are operating in the red, meaning they're operating at a loss. So hospitals are significantly challenged from a financial perspective. I'd like to reinforce one other point, and that is beyond the business of healthcare, the real life meaning of a patient who's on Medicaid, and Lori, if I may, the outpatient dialysis example we talked about a moment ago. Today in Sylacauga, we have 2 providers who provide 5 days a week of outpatient dialysis. SAFE provides transportation for many of those recipients. That's a fantastic program. And those people are being kept alive today. And I'm not trying to I'm not trying to create drama around this. It's just very real. They're being kept alive by those outpatient dialysis treatments. Let's fast forward 6 weeks from now. If that program goes away, that outpatient dialysis patient can't gain access to services here in Sylacauga. They show up in the emergency department at CVMC. Guess what? We don't provide that service on an inpatient basis. So now we're faced with finding a place for that patient to go. Is that Birmingham? Is that Montgomery? Maybe the answer is yes, maybe the answer is no. So then you begin to attack that from a time perspective, and all of a sudden you've gone days without treatments, and you can begin to see the challenges that faces from a public health perspective.
For the entire family as well, because that could be a parent or a grandparent caring for children as well, so it has an effect on the entire family system.
And likely the resources to ensure that transportation occurs to the communities outside of Sylacauga is not very, or Talladega is not very high. So it's a very, very unfortunate set of circumstances, and something that I think people should understand. We've talked a lot about business, we've talked a lot about politics, but really at the beginning and at the end of each day, this is about people. This is about people's health, and unfortunately the ability or lack thereof to be able to provide care that's been so important to them.
And when we talk about people, these situations are mitigated or changed by people. And it is ever so important that people's voices are heard, and to the people that make the decisions. And there are, I mentioned the I Am Medicaid social media campaign. The Hospital Association has a campaign that's underway right now, Glenn.
Hashtag Can You Hear Me Now?
Yeah, Can You Hear Me Now? And there's going to be a press conference in Montgomery tomorrow around this issue of Medicaid. It is sponsored by some of the organizations that we're associated with, like Voices for Alabama's Children. There's also going to be a legislative hearing that is scheduled for tomorrow afternoon at 3:30 in the Star Wars room at the Alabama State House, which that couldn't be more appropriate, could it? No action will be taken. It's a matter of being there and your voice being heard and your presence. The more people that are in a room, the more power that's there. And so many of our Medicaid individuals are, as we've said, children, and children don't necessarily have a voice. They're seniors, and those seniors don't necessarily have a voice because they can't get to a place to express their opinions and their voices. But we have to do that, and so it's incumbent upon us to have our voices heard.
Yes.
And as part of the show, we want to thank you, Glenn Sisk and Margaret. Thank you so much for leading the conversation today. By the time you watch this show, there may be other opportunities that become available to you that we can share so that you can have your voices heard, and we want to make sure that happens. So follow us at gethealthytalladega.com, and you can also find us on Facebook and on Twitter at gethealthy61co. So come back, we'll have another show in a couple of weeks, and a second segment to this show as well, where we'll be hopefully featuring Joel Taylor from Citizens Baptist Medical Center. Thank you for joining us today. Thank you both for being our guests. We look forward to seeing you soon.